For coping effectively with stigma. Here are some ways you can deal with. Get treatment. You may be reluctant to admit you need treatment. Don't let the fear of being labeled with a mental illness prevent you from seeking help. Treatment can provide relief by identifying what's wrong and reducing symptoms that interfere with your work and personal life. Don't let stigma create self-doubt and shame. Stigma doesn't just come from others. You may mistakenly believe that your condition is a sign of personal weakness or that you should be able to control it without help. Seeking psychological counseling, educating yourself about your condition and connecting with others with mental illness can help you gain self-esteem and overcome destructive self-judgment. Don't isolate yourself. If you have a mental illness, you may be reluctant to tell anyone about it. Your family, friends, clergy or members of your community can offer you support if they know about your mental illness. Reach out to people you trust for the compassion, support and understanding you need. Don't equate yourself with your illness. You are not an illness. So instead of saying I'm bipolar, say I have bipolar disorder. Instead of calling yourself a schizophrenic, say I have schizophrenia. Join a support group. Some local and national groups, such as the National Alliance on Mental Illness, NAMI, offer local programs and internet resources that help reduce stigma by educating people with mental illness, their families and the general public. Some state and federal agencies and programs, such as those that focus on vocational rehabilitation or the Department of Veterans Affairs, VA, offer support for people with mental health conditions. Get help at school. If you or your child has a mental illness that affects learning, find out what plans and programs might help. Discrimination against students because of a mental health condition is against the law, and educators at primary, secondary and college levels are required to accommodate students as best they can. Talk to teachers, professors or administrators about the best approach and resources. If a teacher doesn't know about a student's disability, it can lead to discrimination, barriers to learning and poor grades. Speak out against stigma. Consider expressing your opinions at events, in letters to the editor or on the internet. It can help instill courage in others facing similar challenges and don't let stigma create self-doubt and shame. Don't isolate yourself. Don't equate yourself with your illness. Don't let stigma create self-doubt and shame. Don't isolate yourself. Don't equate yourself with your illness. Don't let stigma create self-doubt and shame. Don't isolate yourself. Don't equate yourself with your illness. Politicians and celebrities are also supporting mental health and reducing stigma. President Barack Obama is also active in this cause. At his White House conference on mental illness earlier this month, Obama said, "We whisper about mental health issues and avoid asking too many questions. The brain is a body part, too. We just know less about it. And there should be no shame in discussing or seeking help for treatable illnesses that affect too many people that we love." Lawrence also continued, "It's so bizarre how, in this world, if you have asthma, you take asthma medicine, if you have diabetes, you take diabetes medicine. But, as soon as you have to take medication for your mind, there's such a stigma behind it."
Thank you for watching the video. Have a nice day.